Hi guys, I hope we are all doing great and welcome back to our series on mental health. In our last video, we introduced a topic on adjustment disorder where we gave a definition of adjustment disorder as unhealthy reaction to a life stressors. We also discussed the types of adjustment disorders. We also talked about risk factor, one of them being divorce, illness, or loss of job. We also talked about the symptoms of adjustment disorder, uh, uh, where we talked about anxiety, being tearfulness, being hopelessness as being one of them. Yes, under symptoms of adjustment disorder, some of these symptoms are likely to take place within 3 months. But in an event where someone has lost unemployment, these symptoms can go for more than 6 months. So today, under still on our topic on adjustment disorder, we are still going to look at that and how best it can be managed. Yes, we have seen a number of people expressing maybe various behaviors when they have lost a job, and those are some of the things that can tell maybe one is having an adjustment disorder. So we want to look at some of the behaviors that are likely to be seen on people. One of the common things that happen to somebody who might have lost unemployment, who might have separated with a partner through the divorce, or might have been diagnosed with an illness, is alcoholism. Even if they were not alcoholic, or if they were not drinkers maybe in the past, they develop a new behavior where they drink heavily to an extent that you get to wonder like what is happening with so and so, that it's suddenly they are now heavy drinkers that used not to happen. Another behavior is withdrawal. A person might withdraw from social interaction. They no longer meet with friends, with family, with people. They might spend the whole of their day time being locked in a room, just being solitary. They don't want to interact with anybody. They have even withdrawn from things that they used to like, and social events. So that can tell you that maybe the person is undergoing what is called an adjustment disorder. Uh, the other one is false impression that things are just okay. For instance, um, someone might lose a job and they continue waking up in the morning, going to town where they used to work, stay in a social park like a whole day, then comes back in the evening the way they used to do when they were employed. So these might tell that this person is suffering from an adjustment disorder. They are creating an impression that they are doing well, they are okay, and it creates some perception to hide some perception with the neighbors that so and so is still working, and things are just okay with them. So those are some of the things that someone can do. Maybe when they have lost a job, they still continue waking up. If they used to wake up at 5, they wake up, go to town. Even if there is nothing they are going to do, or there is nobody they are going to meet, they will still continue with that behavior. And it will be impacting on them because they will be using their resources, which now they have lost the source of income, and stuff like that. Another behavior which is very very common is lack of interest or being unkept. All of a sudden somebody just become very old, I can use that term, like they have worn themselves out, they are unkept, uh, they have lost interest, they don't even care whether they put their clothes inside out or not, because that's less of their worries. So that can tell you that somebody is undergoing an adjustment disorder. Now, what can we do, or how can we manage adjustment disorder? Stressors are usually temporary. You learn to cope with them over time. Symptoms of adjustment disorder always get better when the stress eases. Once somebody has started maybe managing the stress, the symptoms also eases. But if some of the stressful event continues part of life, or a new situations come up, and you face the same emotional struggle again, it means that maybe the process might continue for some time. So if this continues, it's very, very important maybe to seek the services of a mental health specialist or a doctor for support. Some of the ways that we can use in managing adjustment disorder is what is called interpersonal therapy. Interpersonal therapy focuses on building communication skills to improve relationships. So if you build relationship with people, you talk, you share out, you will soon realize that maybe it's not you alone who is going through what is happening to you, but you will also learn from people what they might be doing and other things, and you can even be joined in that and learn and cope with your situation. So by developing this relationship, the stress is minimized as a positive social interaction increases. The more you interact with people positively, the stress ceases. Then we have what is called cognitive behavioral therapy. So cognitive behavioral therapy also majorly emphasizes on the importance of our thoughts and emotion, and how that affects our behavior. So if you think about negative things, you think about how things cannot happen, this will really impact negatively on you as an individual. So this skill, this technique is used in a number of mental health conditions, and it has proven to be really doing so well. So the other one is how to manage these is we can talk about what is called stress management. People with high stress level prone to adjustment disorder. So if you have high stress level, there are a lot of things happening to you, a lot is going through your mind, you are likely to have adjustment disorder. So work on your stress, minimize these stresses so that you can also cope with your situations. In other scenarios, people might tend to use medication in treating adjustment disorder, but this is not so much encouraged, because treatment will not help this person to adjust to their situation. So medication, I've seen a number of people using antidepressants when they are going under a stress situation and all that, but that might not help at that particular moment. It's important for somebody to face their situation, find a way of going through it, and they get help. Otherwise, thanks for watching, and keep it here for more.